Hello everyone, welcome to Tech Sharmit. From this session, we are going to start another very important series for medical coding anatomy. From here, we are going to learn about the body planes. So from last couple of sessions, we discussed about the anatomical terms of direction, right? So now this session is in the continuation of the same, where we will be mainly talking about the body planes. Okay. So we'll see it first at the introductory level, then step by step we will go ahead and we'll discuss each and every type of body planes and their subcategories. Okay, and we will proceed in the same way. Like firstly, I'll provide you the notes where I will explain you the theoretical things with definitions, examples, origin of word meaning, right? And then at the end, I'll also share you some tricks to remember these concepts for your exam. And throughout the session, we will also discuss some important things that can be your interview question in exams or interviews, right? So before we proceed further with the session, I would like to remind you that these all sessions are in proper sequence and sync. So if you follow it sequentially, so it would be easy for you because they all are connected with each other. Like we have already covered the anatomical terms of direction, so in this session we will be using that. So if you already know, then it would be very easy for you to understand the body planes. Okay, so for that you can also refer the Tech Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. And in case if there is any question or query related to that, you can simply reach out to me through comment section. I would be more than happy to answer all your queries there. Okay. All right. So let's get started and see what is body planes. So body planes are nothing but an imaginary flat surface that pass through your body to divide it into specific section. Okay. So very important thing that it's a imaginary flat surface. Okay. So imaginary flat surface that basically pass through the body to divide it into specific sections. So in simple words, you can say, imagine slicing the human body with a giant flat knife. Each different of that imaginary slice create a different plane, and body planes are used to describe a direction of a cut, view or a section through the body. But remember, this is imaginary line. Okay, it is not something happening on the real body, it's an imaginary line. So body plane, an imaginary flat surface that cuts through the body to divide into sections. Okay, now let's see why do we really need to understand the body planes. So just like anatomical terms of direction gives us a standard language to describe the location, body planes give us a standard language to describe how the body or an image of the body is being divided or viewed. Okay, so like we know in anatomical terms of direction, it provides us the actual information about the location. Similarly, body planes give us a way or a language to describe how the body is being divided or viewed by the professionals. Okay, now you can see body planes are essentials because in medical imaging, like X-rays, CT scans, MRI scan, takes a picture of the body in a specific plane. Doctors and radiologists must know which plane they are looking at to correctly interpret the image. Okay, so to understand that medical imaging, we should know about these body planes. Similarly, surgeons use plane terminology to describe the direction of surgical incision and approaches. Okay, so for that reason also, surgeon should know what are the terminology related to the body planes. Likewise, anatomist. Yes, anatomists also use the planes to study cross section of the body in the textbook and the dissection. Okay, so to study those cross sections of the body, dissections of the body in textbooks, they need these kind of body planes information and terminology. The next comes medical coders. Yes, medical coders must understand the planes to correctly interpret radiology report, operative report and procedure description, because if they are not aware of these terms, how they will examine the radiology report, how they will understand the operative report, procedure description, because they are doctors and surgeons are going to use those terminology, right? So they should know about the body planes, because without a standardized plane there would be no consistent way to describe which direction a body section or image are present. Clear? So I think this entire information provide you the answer of this question, why do we need body planes? So this is one of your interview question they might ask you, so be prepared for it. Okay, the next thing is a key concept, and this is very important. Okay, you need to understand this very carefully, that planes are just a imaginary. Okay, it is not the actual thing. So it is clear, it should be quite clear that body planes are not physical lines drawn on the body. They are imaginary, invisible, flat surface used only as a reference of description. Okay, so you cannot see a plane on a real person. A plane is a conceptual tool like an invisible sheet of a glass passing through the body. Okay, so just imagine there is a invisible sheet of glass that is passing through your body, dividing into multiple sections. Then that thing is called as body planes. Okay, now we understand what is body plane, why it is important, and also the key concept that it is imaginary. Now the question comes, how many types of body planes are there majorly? So there are actually three main cardinal body planes used in anatomy and medicine. The first is sagittal plane, second is frontal or coronal plane, and the third one is transverse, horizontal or axial plane. These are very important topic, and one by one we will discuss this thing in upcoming session individually because it needs more time. But for now, just keep in mind there are three planes: sagittal plane, frontal or coronal plane, transverse, horizontal or axial plane. Okay, so you can say that these three planes are called the cardinal planes of the body because they are the three primary references plane, and they all are perpendicular. That means they are at 90 degrees to each other, similar to XYZ axis used in the 3D geometry. Yeah, fine. Now earlier we learned about the anatomical terms of direction, right? So how it is related to that? Let's see. If we talk about the sagittal plane, it is related to medial and lateral. If we talk about frontal and coronal plane, it is related to anterior and posterior. If we talk about the transverse plane, it is related to superior and inferior. Okay, now I am assuming you know about the meaning of these terms like medial, lateral, anterior, posterior, superior, inferior, because we have already covered this thing in our previous session. Okay, so we are not going to spend the time again to describe this thing. I'm assuming that you already know it. Okay, so here you can just relate it with these plane. So we can say each plane is essentially the visual imaging representation of a pair of a directional term. You already studied. This connection makes it much easier to remember, apply both concepts together. Okay, alright, so now next thing is planes versus section. This is very important to understand because these are two important terms that we will be frequently using. So plane is an imaginary flat surface itself, okay, the concept of line of cutting, but a section is actual the image, slice or a view that results from cutting along the plane. Okay, so plane means the actual thing, the imaginary thing that is cutting the cutting concept, right? But a section is the actual image, slice or the view that result from cutting along that plane. Okay, so we can say that a sagittal plane is the imaginary line, but a sagittal section is the actual picture slice you see after cutting along that plane, like a sagittal MRI image of the brain. Fine. So in clinical practice and radiologist experts reports, both terms are often used to somewhat interchangeably, but technically the planes is concept and the section is the resulting image. This is just a simple thing but very important. Okay, now the question comes how you will remember all these things. So there is a very simple way. Okay, So just think and imagine a body like slicing a loaf of a bread, a cake, or an apple in different directions. Okay, so slicing top to bottom, front and back separated like the sagittal plane. Slicing top to bottom, side by side like a frontal coronal plane. Slicing straight across horizontally like a transverse plane. If you don't know about these terms, don't worry, these things we will discuss separately when we will be discussing it. But for now, just keep in mind that this is how it works if you are imagining it as a slicing a piece of cake. Okay. Now you can imagine that straight down the middle, left half and right half, it is a sagittal. Straight down the other direction, front half and back half, it is a frontal and coronal. Straight across horizontal, top half, bottom half is the transverse. Okay, so yeah, that's all for today. In today's session we talked about what are body planes and why it is important to learn, and the types, at least the introductory part. Okay, in the next session we will discuss few more things, and before that, before we conclude the session, there is one question for all of you, and today's question is, what is unilateral anatomical terms of direction? I'm sure you already know the answer of this question. So please do share your knowledge in the comment section, because once you start writing the answers, it will indicate me that you are learning from this session, and accordingly I will release the more sessions in it. Okay. Also, it will help others to understand the concepts better. So please do share, so that if someone don't know the answer, they can simply look at the comment section. So yeah, that's all for today. See you in the next session with new topic. So thank you for watching Tech Sharmit.